Chapter 42, Fluids, Electrolyte, and Acid-Base Balance. Cellular fluids contain electrolytes, like sodium and potassium, and they also have a degree of acidity. The characteristics of body fluids influence the body system functioning because of the effects on cell functioning. It is important to understand how the body normally maintains fluids, electrolytes, and acid-base balance. Body fluids located in two distinct compartments. One is extracellular fluid, which is outside of the cells, and one is intracellular fluid, or inside the cells. The fluid in body compartments contain mineral salts that are known as electrolytes. Electrolytes are compounds that separate into ions or charged particles when they are dissolved in water. Ions that are positively charged are called cations. This would be sodium, potassium, calcium, magnesium. Ions that are negatively charged are called anions. This would be chloride and bicarbonate. You need to be familiar with table 42.1 in your text. The term isotonic refers to fluid that has the same tonicity as normal blood. A hypotonic solution is more dilute than blood. A hypertonic solution is more concentrated than blood. Active transport requires energy in the form of ATP or adenosine triphosphate. This moves electrolytes across cell membranes against the concentration gradient, meaning that it goes from areas of lower concentration to an area of higher concentration. Diffusion is passive movement of electrolytes down a concentration gradient. So it goes from an area of higher concentration to an area of lower concentration. Osmosis. This is the way in which water moves through the membrane that separates fluids with different particle concentrations. Filtration. Filtration is the actual effect of four forces. Two that move fluid out of the capillaries and small venules, and then two that move the fluid back into them. The average fluid intake for an adult is about 2,300 milliliters. Fluid distribution is the movement of fluid among the various compartments. The fluid distribution between the extracellular and intracellular compartments occurs by osmosis. The fluid distribution between the vascular and interstitial parts of the extracellular fluids occurs by filtration. The fluid output normally occurs through four organs: skin, lungs, gastrointestinal tract, and the kidneys. The kidneys are also the major regulator of fluid output because they respond to hormones that will influence the urine production. ADH, or the antidiuretic hormone, regulates the osmolality of the body fluids by influencing how much water is excreted in the urine. It is synthesized by the neurons in the hypothalamus that release it from the pituitary gland. The renin-angiotensin-aldosterone system regulates the extracellular fluid volume by influencing how much sodium and water are excreted in urine. This also contributes to the regulation of blood pressure. The atrial nitrinuretic peptide. This regulates the extracellular volume by influencing how much sodium and water are excreted in the urine. The cells in the atria of the heart release the ANP when they are stretched by an increased extracellular volume. ANP is a weak hormone that increases the loss of sodium and water in the urine. What will Robert discover about the patient through their history? The history does reveal that she is at risk for a fluid and electrolyte imbalance from a gastrointestinal disturbance and the continued use of a diuretic. A patient is diaphoretic and has an oral temperature of 104 degrees Fahrenheit. These are classic signs of ADH deficit, extracellular fluid loss, insensible water loss, or sensible water loss. The answer is D, sensible water loss. There are two major types of fluid imbalances, volume imbalance and osmolality imbalance. Volume imbalance are disturbances of the amount of fluid in the extracellular compartment. Osmolality imbalance are disturbances of the concentration of the body fluids. Extracellular volume deficit. There is insufficient isotonic fluid in this extracellular compartment. There is a lot of sodium in normal extracellular fluid. With extracellular volume deficit, there is an output of isotonic fluid that exceeds the intake of sodium-containing fluid. In extracellular volume excess, there is too much isotonic fluid in the extracellular compartment. The intake of sodium-containing isotonic fluid has exceeded the fluid output. This would account for some individuals having ankle swelling after eating salty foods. Osmolality imbalance is when the body fluids become hypertonic or hypotonic. This causes osmotic shifts of water across cell membranes. The osmolality imbalances are hypernatremia or hyponatremia. Hypernatremia is water deficit. It's a hypertonic condition. There are two general causes that make body fluids too concentrated. Loss of relatively more water than salt, or a gain of more salt than water. The interstitial fluid becomes hypertonic. Water leaves the cell by osmosis and they shrivel. Signs and symptoms that would be seen are those of cerebral dysfunctioning. This arises when the brain cells shrivel. Hypernatremia may occur in combination with extracellular fluid volume deficit. This combined disorder is called clinical dehydration. Hyponatremia. This is a water excess or water intoxication, a hypotonic condition. This arises from gain of more water than salt or a loss of more salt than water. The excessively dilute condition of interstitial fluid causes water to enter the cells by osmosis. This causes the cells to swell. Signs and symptoms of cerebral dysfunction occur when brain cells swell. Clinical dehydration. This is an extracellular volume deficit, and hypernatremia occur simultaneously. Extracellular volume is too low, and the body fluids are too concentrated. This is common with gastroenteritis or causes of severe vomiting and diarrhea when individuals are unable to replace their fluid output with enough intake of dilute sodium-containing fluids. Electrolyte distribution is vital within the body cells. Plasma concentrations of potassium, calcium, magnesium, and phosphate are low compared with the concentration of the same electrolytes in cells and bones. The concentration differences are needed for routine, normal muscle and nerve functioning. Electrolyte output occurs through normal excretion in urine, feces, sweat, vomiting, drainage tubes, or fistulas. When electrolyte output increases, electrolyte intake must increase to maintain the electrolyte balance. Think about homeostasis. Hypokalemia is an abnormally low potassium concentration. It's due to decreased potassium intake and absorption, a shift of potassium from extracellular fluid into the cells, or an increased potassium output. Common causes would be diarrhea, repeated vomiting, and use of potassium-wasting diuretics. Hyperkalemia is an abnormally high potassium concentration. People who have oliguria or decreased urine output are at risk of hyperkalemia from the result of decreased potassium output, unless their potassium intake also decreases substantially. Hypocalcemia is an abnormally low calcium concentration. People that have acute pancreatitis will develop hypocalcemia because calcium binds to undigested fat in the feces and can be excreted. This process decreases the absorption of dietary calcium and increases calcium output by preventing the reabsorption of calcium that's contained in gastrointestinal fluids. Hypocalcemia increases neuromuscular excitability. Hypercalcemia is an abnormally high calcium concentration. This weakens the bones, and the person sometimes will develop a pathological fracture, meaning that the bone will break because of forces that would not cause a healthy bone to break. Hypercalcemia decreases neuromuscular excitability and causes lethargy. Hypomagnesemia. This is an abnormally low magnesium concentration. Signs and symptoms are similar to hypocalcemia because hypomagnesemia also increases neuromuscular excitability. Hypermagnesemia. This is an abnormally high magnesium concentration. End-stage renal disease will cause hypermagnesemia unless the person decreases the magnesium intake to match the output. Signs and symptoms are caused by decreased neuromuscular excitability, with lethargy and decreased deep tendon reflexes being the most common. Please see Table 42.5 in your text. Expected assessment activities for this patient would be to ask the patient to describe their nausea and what accompanying signs and symptoms they are experiencing. An examination of the GI and urinary functioning should occur. Vital signs should be assessed. Skin and mucous membranes should be assessed for indicators of dehydration. And laboratory values and the EKG results should also be evaluated. For acid-base balance, you need to look at Table 42.6 in your text. Acid-base homeostasis is the dynamic interplay of three processes: acid production, acid buffering, and acid excretion. A pH of 7.0 is considered neutral. The normal pH range of adult arterial blood is 7.35 to 7.45. Maintaining the pH within this range is vital for optimal cellular functioning. So the lab values that we need to know to determine acid-base balance: the pH, it should be between 7.35 to 7.45. The PaCO2, or the partial amount of carbon dioxide, should be 35 to 45 millimeters of mercury. The bicarbonate, or the HCO3 value that needs to be known, is 21 to 28 milliequivalents per liter. These need to be written on a flashcard for acid-base balance and memorized. Buffers are pairs of chemicals that work together to maintain the normal pH of body fluids. The body has two acid excreting systems: the lungs and the kidneys. The lungs excrete carbonic acid. The kidneys excrete metabolic acids. The body's fluid and electrolyte balance is maintained partially by hormonal regulation. Which of the following statements shows an understanding of this mechanism? The pituitary secretes aldosterone. The kidneys secrete antidiuretic hormone. The adrenal cortex secretes antidiuretic hormone. The pituitary secretes antidiuretic hormone. The answer is D. The pituitary gland secretes antidiuretic hormone. Acidosis is a condition that tends to make the blood too acidic. Because body cells produce two types of acid, there are two different types of acidosis: respiratory acidosis and metabolic acidosis. Alkalosis is a condition that makes the blood too basic or alkaline. There are two types of alkalosis: respiratory alkalosis and metabolic alkalosis. Respiratory alkalosis can happen due to hypoventilation. The lungs are unable to excrete the carbon dioxide. The PaCO2 level rises, so this is an excess of carbonic acid in the blood, and the pH decreases. The kidneys will compensate by increasing the excretion of metabolic acids in the urine, which increases the blood bicarbonate. The compensatory process is slow, taking roughly 24 hours to show any clinical effects, and 3 to 5 days to reach a steady state. A decreased cerebral spinal fluid pH and an intracellular pH of brain cells cause decreased level of consciousness. Respiratory alkalosis. This is from alveolar hyperventilation. This is the lungs excreting too much carbonic acid. The PaCO2 level will fall. This increases the pH. Routinely, this is short-lived. The kidneys don't have time to compensate. This causes neurological symptoms, excitement, confusion, paresthesia. Metabolic acidosis. This is an increase of metabolic acid or a decrease of bicarbonate. The kidneys are unable to excrete enough metabolic acids. These accumulate in the blood, or bicarbonate is removed from the body, as in having diarrhea. Metabolic alkalosis is a direct increase of alkaline or base, HCO3, or a decrease of metabolic acid. Common causes for metabolic alkalosis include vomiting and gastric suctioning. Nursing knowledge helps formulate assessment questions to determine the risk factors for fluid, electrolyte, and acid-base imbalance. We assess the signs and symptoms of imbalancing. We implement nursing and collective interventions to maintain or restore balance or homeostasis. The skills and techniques for safe intravenous therapy are a vital area of nursing knowledge and focus of nursing research to support evidence-based practice. For critical thinking with the use of intravenous therapy, the nurse needs to have a knowledge base of fluid, electrolyte, and acid-base balance. In the older adult population, there are various factors that will influence the fluid, electrolyte, and acid-base balance. The body composition changes with age, causing a decreased percentage of body water from 60 to 50%. This increases the risk of extracellular fluid volume deficit and dehydration. The combined effects of age, chronic diseases, multiple medications also pose challenges to maintaining fluid and electrolyte balance. Impaired mobility or bladder control may restrict fluid intake. This will increase the risk of hypernatremia and extracellular volume deficit. The thirst mechanism sensation is decreased. This increases the risk of hypernatremia and dehydration. The nurse should not rely on thirst to assess for hypernatremia, extracellular volume deficit, or dehydration in patients who are confused, that have altered level of consciousness, are extremely young, or very old. Severe dehydration may result in postural hypotension, especially older adults. They need to arise slowly when taking orthostatic blood pressure measurements. Cardiovascular illnesses decrease the body's ability to adapt to sudden increases in vascular volume, increasing the risk of pulmonary edema with rapid infusion of isotonic IV fluids. Chronic renal disease results in a decrease in the kidney's ability to concentrate urine. This increases the risk for hypernatremia, an extracellular volume deficit, or dehydration. The kidney changes of normal aging make it difficult to excrete large acid loads. This just increases the metabolic acidosis risk with normal aging process. There are various common medications that can cause fluid, electrolyte, and acid-base imbalances. ACE inhibitors like the Pril medication and the angio-2 receptor blockers. These cause hyperkalemia. Antidepressants, SSRIs. These cause hyponatremia. Calcium carbonate antacids. These cause hypercalcemia and mild metabolic alkalosis. Corticosteroids, your prednisone. This causes hypokalemia and metabolic alkalosis. Diuretics, your furosemide and Lasix, as well as thiazides. These cause extracellular volume deficit and hyponatremia. They can also cause hypokalemia, hypomagnesemia, and mild metabolic alkalosis. Laxatives. These cause an extracellular volume deficit, hypokalemia, hypocalcemia, hypomagnesemia, and metabolic acidosis. Refer to Table 42.10 in your text. Daily weights are an important indicator of fluid status. Each kilogram or 2.2 pounds of weight gained or lost overnight is equal to 1 liter of fluid retained or lost. Measuring and recording all liquid intake and output during the 24-hour period is an important aspect of maintaining fluid balance. The nurse should compare the patient's 24-hour intake with their 24-hour output. The two measures should approximately equal if the person has a normal fluid volume balance. This is case study assessment of the patient. Knowing all of this data, what nursing diagnosis should be chosen? Think about the nursing diagnosis: dehydration related to loss of gastrointestinal fluids by vomiting. The nurse will assess postural blood pressure and pulse. The patient will have blood pressure, postural hypotension with an increased heart rate, and the pulse will be weak. They will inspect the oral mucous membranes for degree of moisture. The oral mucous membranes between the cheek and gum are dry. They will obtain daily weight measurements. The adult patient will lose 2.2 pounds or 1 kilogram or more within 24 hours. They will measure the urine output and observe color. If available, they will measure the specific urine gravity of the urine. Patient will produce a small volume of urine that will be dark yellow in color, and the urine specific gravity will show an increase. The nurse will test skin turgor, which is not always reliable for older adults, but there will be a decrease in skin turgor. What expected outcomes would Robert establish for the goals? A senior nursing student delegates the task of intake and output to a new nursing assistant. The student will verify that the nursing assistant understands the task of intake and output when the nursing assistant states, "I will record the amount of all voided urine. I will not count liquid stools as output. I will not record a cafe mocha as an intake. I will notate perspiration and record it as a small or large amount. The answer is A. I will record the amount of all voided urine. When planning for any patient, whether they are having respiratory or metabolic issues, urinary issues, the nurse needs to make sure that she always considers the patient and adds them in with the planning phase for the care plan. During the planning process, critical thinking will be used to synthesize information from all different sources. This will ensure that the patient's care plan integrates scientific and nursing knowledge, and any and all information is gathered about the patient. The following related outcomes established for the goal, the patient receives normal hydration status at discharge, are as following. The patient is free of complications associated with the intravenous device throughout the duration of the intravenous therapy. The patient demonstrates balanced intake and output measurements within 48 hours. The clinical condition determines which diagnosis takes the greatest priority. Many diagnoses are in fluid, electrolyte, and acid-base balance are of the highest priority because of the seriousness or life-threatening consequences. An additional expected outcome that would be included is that the patient will not have more than one stool in a day for 3 days. Think about interventions. Health promotion activities focus primarily on patient education, which the nurse provides based on the patient and the family's health literacy. The nurse needs to use plain language to teach patients and caregivers to recognize risk factors for developing imbalances and to implement the appropriate preventative measures. Look at figure 42.12 in your text. There are 4 nursing diagnoses related to the primary health problem and the priority assessments. Nausea related to gastric irritation. Dehydration related to vomiting and diarrhea. Risk for impaired skin integrity. Diarrhea related to intestinal inflammation. What would be the one you would consider working on first that might be beneficial to assist in the other diagnoses? Central venous lines deliver intravenous fluid into the superior vena cava near the heart. This is known as a central venous access device. Acute care nurses administer medications, oral, IV fluids to replace fluid, electrolyte deficits, or to maintain normal homeostasis. The nurse will also help with restricting intake as therapy for fluid excess. The oral replacement of fluids is contraindicated when the patient has a mechanical obstruction of the gastrointestinal tract, severe nausea, a high risk for aspiration, or impaired swallowing. A feeding tube is appropriate when gastrointestinal tract is healthy but cannot ingest fluids. The option for administration includes a gastrostomy or a jejunostomy tube through a small bore nasogastric feeding tube. Fluid and electrolytes may be replaced through the infusion of intravenous fluids and not the digestive system. Parenteral replacement. This includes parenteral nutrition, IV fluid and electrolyte therapy, and blood component administration. Common intravenous or IV sites are A, the inner arm, or B, the dorsal surface of the hand. The correct selection and the preparation of the IV equipment helps in safe and rapid placement of an IV line. Because fluids infuse directly into the bloodstream, only sterile technique may be used. Intravenous devices are also called peripheral IV when the catheter tip lies in a vein within an extremity. They are called a central venous catheter when the catheter tip lies in the central circulatory system, which would be the vena cava close to the right atrium of the heart. IV solutions are isotonic, hypotonic, or hypertonic. You need to view table 4211 in your textbook. Isotonic solutions have the same osmolality as body fluids. Sodium-containing isotonic solutions like normal saline are indicated for extracellular volume replacement to either prevent or treat an extracellular volume deficit. Hypotonic solutions have an osmolality that is less than body fluids, decreasing osmolality by diluting body fluids and moving water into the cells. Hypertonic solutions have an osmolality that is greater than body fluids. If the solution is hypertonic sodium-containing solution, it will increase osmolality rapidly and pull water out of the cells, causing shrinking. The decision whether to use hypo, or isotonic solution is made on the patient's specific fluid and electrolyte balance or imbalance by a primary care physician. Venous devices for long-term use will include central catheters, implanted ports. Both of these empty into a central vein. Peripherally inserted central catheters or PICC lines, they enter a peripheral arm vein that is extended through the venous system to the superior vena cava. A central line is more effective than a peripheral line for administering large volumes of fluid, parenteral nutrition, medications, or fluids that may irritate veins. Parenteral nutrition, also known as total parenteral nutrition or TPN, is an IV administration of fluids that are complex and highly concentrated. The solution contains nutrients and electrolytes that are formulated to meet the specific needs of the patient. Depending on the osmolality of the patient, parenteral nutrition solutions are administered through central venous access devices of high osmolality or peripheral IV venous line for lower osmolality solutions. The safe administration depends on the appropriate assessment of the nutritional needs, then the meticulous management of the central line or the peripheral IV line to prevent infection, as well as monitoring to prevent any metabolic complications. A blood transfusion, this is when IV administration of either whole blood or blood components such as packed red cells, platelets, or plasma. The objectives when administering blood transfusions include increasing the circulating volume of blood after surgery, trauma, or hemorrhage. Number 2, increase the number of red blood cells and maintain the hemoglobin levels in patients that have severe anemia. Or 3, providing a selected cellular component for replacement, like clotting factors, platelets, or albumin. When looking at the types of blood, an ABO system is what is used. There are 4 types of blood: A, B, O, and AB. The determination of the blood type is made on the presence or the absence of either A and or B antigens. Individuals that have type A blood have A antigens and B antibodies in the plasma. People with type B blood have B antigens and A antibodies in the plasma. AB blood has both A and B antigens, and there's no antibodies. Type O blood has neither A or B antigens, but has both the A and B antibodies that are in the plasma. A universal donor is considered an O negative blood type because it can donate packed red cells and platelets to individuals of any blood type. A universal recipient, this is a person that has AB positive blood type, because these individuals can receive packed red cells and platelets of any ABO type. An autologous transfusion, also known as an autotransfusion, is the collection and reinfusion of the patient's own blood. Blood from an autologous transfusion obtained by preoperative donation may be up to 6 weeks before the scheduled surgery. There are rationales for the interventions that Robert used. Replacement of body fluids restores blood volume and normal serum electrolyte levels. An isotonic solution will expand the body's intravascular fluid volume without causing a fluid shift from one compartment to another. Pepto-Bismol is an antidiarrheal and is given to inhibit GI secretions, stimulate absorption of fluid and electrolyte balance, inhibit intestinal inflammation, and suppress the growth of H. pylori. Intake and output documents hydration and fluid balance to help guide therapy. Daily weights provide reliable data on the fluid balance of the individual. Furosemide or Lasix is a potassium wasting diuretic. The body doesn't store potassium. Therefore, dietary supplements that are rich in potassium are going to be required. For blood therapy, we need as nurses to always verify 3 things. Number 1, the blood components delivered are the ones that were ordered. Number 2, the blood delivered to the patient is compatible with the blood type that is listed for the patient in the medical record. And number 3, that the right patient receives the correct blood product. Together, 2 RNs, or 1 RN and 1 LPN, may check the label on the blood product against the medical record and the patient's medical record number, the blood group, and the patient's complete name to ensure that this is appropriate where you are working. You will need to check the institution's policies and procedures. But routinely, it may be 2 RNs or 1 LPN and 1 RN to check the blood product against the patient's information. The transfusion rate that is specified in the provider's order. The unit of whole blood or packed red cells is transfused in 2 hours, and the time can be lengthened to 4 hours if the patient is at risk for extracellular volume excess. Beyond 4 hours, the blood product is not used because there is a potential for bacterial contamination. If the nurse suspects that there is a transfusion reaction occurring, the transfusion reaction must be stopped immediately. The IV line will be kept open after replacing the tubing and hanging a new bag of normal saline or 0.9% sodium chloride at a slow rate. The nurse will not turn off the blood and simply turn on the saline that is hanging and connected to the Y tubing infusion set. This is going to further complicate the patient's life because any blood that is remaining in the tubing will be infused into that patient. The smallest amount of any additional blood can make the patient's situation worse and their life critical. As a nurse, you must exchange the tubing and the bag of saline. The healthcare provider will be notified immediately. As the nurse, you will stay with the patient and observe signs, symptoms, and monitor vital signs every 5 minutes. You will be prepared to administer any emergency medications, which might be antihistamines, vasopressors, fluids, and corticosteroids, depending on an order or the protocol at the institution. You are prepared as a nurse to perform CPR. You as the nurse will save the blood bag, the tubing, the labels, and the record for the transfusion and return it to the blood bank. You will go ahead and obtain blood and urine specimens per the doctor order or institution protocol. After experiencing any acute alteration in fluids, electrolytes, or acid-base balance, many patients may often require ongoing maintenance to prevent a reoccurrence of health alterations. Robert discusses the sources of potassium in the diet with the patient and writes this documentation note. Denies nausea and reports feeling better, in quotation marks. No diarrheal stool since yesterday afternoon around 3 p.m. On inspection, oral mucosa remains dry without lesions or inflammation. Skin turgor is normal. Bowel sounds are normal in all 4 quadrants. Abdomen soft to palpation. IV of 0.9% normal saline infusing in left cephalic vein forearm at 40 mL per hour per MD order. No tenderness or inflammation at IV site. Is able to identify 5 food sources for potassium to be included in the diet. Resting comfortably out of bed in a chair. Consumed all breakfast. Will continue to monitor. When performing an evaluation, ensure that you ask the patient if their expectations were met. It's important to note whether or not we as nurses have been able to meet the expectations of our patients.